In this video, I will cover a common question I get on how to reduce inflammation from an injury without medications. Expect to learn the following: why does inflammation happen in the first place? The difference in acute versus chronic inflammation, why only getting rid of inflammation but not improving the function is dangerous, and natural ways to reduce inflammation without getting injections or taking medications. Those of you who don't know me, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert. My focus is on diagnosing and treating adhesion, also known as scar tissue, and reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which leads to a significant increase in overall functioning, flexibility, and long-lasting pain relief. Just a reminder, if you're dealing with chronic pain from an injury and you're struggling to get some real answers as to what is going on, you can submit your questions directly to me. And if my insights can help, I will be sure to get a video out to you. So why does inflammation happen in the first place? There's several factors that contribute to that. Number one is just a direct injury. Maybe you fell in a hole. Maybe you fell out of a tree. Maybe you got hurt doing some type of athletic endeavor, working out, something like that, where the tissue was just damaged. And the inflammation is a process where the body goes through and tries to heal it. Another way is just from sustained contractions. What does that mean? Basically, just sitting too long, poor posture, looking down at your phone, sitting at a computer all day, not moving enough. When this happens, your muscles actually get stretched out. And when they get stretched out, they don't get enough blood flow and they don't get enough oxygen. And they start to develop this stuff called adhesion. It's like a glue that gets inside the muscles and makes it really hard for the muscles to be able to stretch and contract how they're supposed to. And then eventually they get stuck to the nerves. When they get stuck to the nerves, the body really thinks there's damage there. So it starts to lay down a lot of inflammation to help kind of buffer and heal that area up. Another way is just lots of stress. Pretty much everyone in modern society has some level of stress. When this does, it kicks on this stuff called cortisol, which also kicks up inflammation as well. Another one is just not sleeping good. When you don't sleep properly, your tissues can't heal, your body can't heal. Your body just kicks up that inflammation to want to try to help. Another one is a lousy diet. A lot of people eat a lot of processed stuff, a lot of garbage, a lot of things like that. And it just causes inflammation in the body as well. And then lastly is just not recovering properly in between workouts. A lot of people go hard all the time. They just are constantly doing stuff and never giving their body a chance to recover. So that inflammation kicks up a lot. So there's a lot of ways where inflammation can happen. Just recap: a direct injury, sustained contractions, lots of stress, not sleeping good, lousy diet, and not recovering properly between workouts. So what is the difference between acute versus chronic inflammation? I believe acute inflammation is actually good. When the injury first happens, it helps to get the healing process going. Essentially, we need to let the body kind of do its thing in the beginning. We used to always think, oh, if something got hurt, we should throw some ice on it, we should rest it, we should elevate it. Now it's like, hey, when things get bad, let it swell up. Let the body do its thing, especially in that acute process, because the body knows what it's doing. When we get into some bad stuff is when it becomes chronic, where that acute process just continues to go. It doesn't shut it down, and it just continues to damage the tissues more and more. And a lot of people are stuck with this chronic systemic inflammation, coming from all those factors I talked about before. But when that body's in that constant inflammation, it just damages everything in there: the muscles, the joints, the tendons, the cartilage, the disc. It can cause a lot of problems. Why getting rid of inflammation but not improving the function is actually dangerous. There's this idea called cause and effect. I see this a lot, especially in types of injuries where the client develops or the patient develops this stuff called bursitis, where it's basically inflammation in there. And the main treatment mechanism is to go in and get rid of that swelling. But here's the thing: the inflammation in the bursitis kicking in is actually the effect. It's not the true cause. So if you go in there and get rid of the effect, but you don't get to the cause, you're actually causing that problem to be a lot worse. We really have to understand, why is the inflammation happening in the first place? And a lot of times there's damage to the muscles, to the joints, to the cartilage, underlying tissues, and that inflammation is happening there. And it's trying to help buffer that area and help it heal. And if we just get rid of that inflammation, but we don't improve any of that tissue, it's actually very dangerous. It can cause a lot of problems. And then the other problem is when we just take away the inflammation, but we don't fix anything, it temporarily feels better. So you're actually going to do more, but the tissue isn't healthy. and it can't handle all that, but you don't have that mechanism or that feedback of like, this is sore, lay off it. You just continue to go, and then that damage of that tissue continues to get worse and worse. Then you deal with bigger problems like muscle tears, tendon ruptures, disc ruptures, cartilage damage, all sorts of things, and big problems that you don't want to deal with down the road. So, what are some natural ways to reduce inflammation without getting injections or taking medications? Number one is just start with getting the tissue healthy. And that can be done by getting awesome soft tissue treatment by a provider. We actually train them all over the world. If you're interested in that, send us a message. We'll get you hooked up with an awesome adhesion treatment provider that can go in and get that tissue healthy and help get that inflammation at bay. I would start with getting hydrated first. So many people are actually very dehydrated. Start by getting hydrated first. Get more water in there. That's going to just make a lot of things better. A lot of that soreness, a lot of that chronic inflammation is going to get better just by being more hydrated. Next is try cutting out inflammatory foods and drinks. I know this sounds, kind of boring and not fun, but two things that I believe, and I've seen it in my own health and other people that I've worked with in my clinics as well, is cutting out alcohol and then cutting out dairy. They're just so inflammatory. And honestly, when I don't have alcohol and dairy, I feel so much better. But when I do have one of those things, the next day I'm just swollen, my joints hurt, my eyes are puffy. I just don't feel great. And I think there's a lot of problems associated with those two foods specifically. Next is just continue to get movement throughout the day. A lot of people might exercise first thing in the morning or the end of the day, but then they're stuck all day long sitting at a desk, working at a computer, not moving. Just get little bits of movement throughout the day. They say aim for 10,000 steps. You don't have to do 10,000 all at once. Just get up and move every 10 or 15 minutes. Get up and do a little bit of a walk, or say you've been sitting for an hour, go for a 5-minute walk. And that can add up throughout the day. You want to think of like your body and your joints and your muscles as like a hinge, and it needs to be greased throughout the day. So if you keep moving all day long, it's going to keep those tissues healthy and keep that inflammation at bay. Next is just learn to breathe better. Breathing is so important, and breathing through your nose. There's a lot of talk about that. Breathing through your belly, not through your neck. One thing that I really started doing, I've been doing it for I think like a year now, is I use this stuff called hostage tape, which is a mouth tape that you put over your mouth at night. People are like, "Oh, that's crazy. How can you breathe?" Honestly, it's been amazing. It forces you to breathe through your nose. Your nose just has a better filtration system. And when you have a better filtration system, you can get rid of all that nasty inflammation, get it out every night when it's causing a problem. And lastly, is just prioritize a sleep schedule. So many people are just like not sleeping good. They're up all night looking at their phones, doing all sorts of stuff. Like, just go to bed. And the best thing that I've learned myself is like not waking up with an alarm, but instead having a bedtime. I try to go to bed around the same time every night, and that just puts me in a much better rhythm, much better sleep. So just to recap, all the natural ways to reduce inflammation is get your tissue cleaned up first by an awesome adhesion provider. Next is start hydrating better. That's going to help a lot. Try to cut out some of those inflammatory foods, especially alcohol and dairy. Get movement throughout the day. Learn to breathe better, especially through your nose. And lastly, just be a normal human and have a bedtime and get to sleep. It's going to help your body heal up a lot better. If you've been dealing with a chronic pain from an injury for at least 6 months, you've seen way too many providers, and you're still having issues, then reach out directly to us and set up an injury consultation to get some real answers as to what is going on and get on the path to long-lasting pain relief, so you can stay away from pain pills, injections, and surgeries that only make things worse. All the information to do that or request a consultation directly with us is available in our description wherever you're consuming this. I appreciate you watching, and we'll catch you on the next one.